Hello everyone, myself Dr. Soumya, Assistant Professor in charge HOD, Department of Pharmaceutics, Yenepoya Pharmacy College and Research Center. So I will be talking on the topic today, dosage form. So we will see what is dosage form and what are the contents we will discuss in today's presentations. So these are the table of contents. First I will take up with the introduction, classification of dosage form, brief introduction about various dosage form for all this novel drug delivery system. So what is the specific learning outcomes after listening to this talk? So at end of the lecture, students should know the need of various dosage form with advantages and disadvantages. So we will move on to the introduction part. We will see what is dosage form. So dosage form is defined as physical form of a dose of a chemical compound used as a drug or medication intended for administration or consumption. So we can see that what is dosage form now. So dosage form is mainly it contains active pharmaceutical ingredient which is responsible for the pharmacological action, as well as we can tell it is a therapeutic action. So active pharmaceutical ingredient, it is a drug or it is responsible for the pharmacological action. Other than that active pharmaceutical ingredient, it also contains excipients. Now what is this excipients? So excipients are added ingredients to the dosage form, but it is not having any pharmacological action. So this is what the inactive ingredients which are present in a dosage form. So if I am taking like one example for mainly fever, if a person or patient is suffering with the fever, we will give mainly Calpol 500. So Calpol 500 is a main content, which in that it is a paracetamol 500 mg. So paracetamol 500 mg is mainly treats or which relieves the fever, but other than the paracetamol there are added ingredients over there. So that will be there in a label wherever it is, or in a packaging material it is there what are the ingredients in a Calpol 500, but only paracetamol 500 mg is responsible for relieve the whatever fever the patient is suffering with. So common dosage forms, what are the classification of common dosage forms? Mainly dosage form can be classified into solid dosage form, liquid dosage form and semi-solid dosage form. So if you are going with the solid dosage form, mainly tablet can be the one example, capsule can be the another example, as well as the syrup is a liquid dosage form, inhalers again it may come in some of the solution form only inside it, so injection again. So these are the different examples for the dosage forms. The route of administration, now route of administration is what? It is mainly for the drug delivery which is independent on the dosage form of a substance. So the next we will move on to dosage form. I told dosage form contains active pharmaceutical ingredient, that is API what we will call, plus excipients. So excipients is a inactive materials which is present in the dosage form, which is doesn't have any of the pharmacological action. But in case if took some tablet for fever and fever is reduced from that, means the main responsible to reduce the fever is active pharmaceutical ingredient. So active pharmaceutical ingredient, it is a chemical compound intended for used in the diagnosis, treatment or prevention of disease. So this is what the main function of active pharmaceutical ingredient. We can call it as a API also. So it is a drug. And excipients are the substances which does not have any pharmacological action, but it can be added over there as a sweetening agent or a coloring agent or preservative. So this will be this will be having other actions, but it will be not interfere with the pharmacological actions. So these are the main classifications of dosage forms. The first one is like a solid dosage form, the next is a liquid dosage form, and next is a semi-solid dosage form. So under solid dosage form there are unit dosage form, examples are tablets, capsules, etc. There are bulk dosage form, in that we can classify again it as a internal bulk dosage form and external bulk dosage form. So what is this internal bulk dosage form? Internal bulk dosage form is, example will come under that is free powders or granules, whatever it is. So when we are comparing with external bulk dosage form, we can call it as a like dusting powder can be the example for external bulk dosage form. So under the main classification of liquid dosage form, it is classified into biphasic and monophasic. As the name indicates, there are two phases in a biphasic, there are one phase in a monophasic. So again monophasic can be classified into the internal and external dosage form. So in biphasic, the examples are emulsions and suspensions. In further slides we can see what is in detail about the emulsion, suspension or any other monophasic dosage forms. The next main classification is a semi-solid dosage form. So semi-solid dosage form is mainly for internal use and for external use. So internal use, suppositories and pessaries are the examples. External use, that everyone knows that ointment, creams, paste, gels, so these all will come under semi-solid dosage form for external use. So we will see what is the need of this dosage form, why we require the dosage form. The first one is accurate dosage. So if we want accurate dosage, at that time we require need of this is what the particular need of dosage form. If you want accurate dose of a particular drug, we have to go for a dosage form. The next is protection of drug substances. Sometimes drug is having stability issue, at that time we have to go for protecting the drug substance. For that we can go for a selection of some suitable dosage form. The next is conceal the bitter taste. Sometimes what it happens, mainly some of the drug is having bitter taste. So I have to go for a different dosage forms where I can conceal or mask the bitter taste. For that I can go for, maybe if one drug is having bitter taste, I cannot give in the form of tablet, but I can give in the form of capsules, because capsules in outside it is covered with some of the shells. So the taste will not be there for the patient when he will consume. So at that time I can conceal the bitter taste of from particular drug. The stability of drug. Stability of drug is another form of technique. So whenever we can want to maintain the stability of the particular drug, we can go for a suitable dosage form. Other than this, to provide the safe and effective drug delivery, if we want to provide safe and effective drug delivery, at that time we can go for a dosage form. Other than this, the included point is to improve the therapeutic efficacy. Ultimately, our aim is to increase the therapeutic efficacy of the particular drug and to enhance the bioavailability of particular drug. So for this purpose, we can go for a need of dosage forms, or we require dosage form particularly. So we will see why we need of various dosage form. Maybe for the particular drug it is having in the tablet form, why we require again in the syrup form or any other dosage form, why we require. For one drugs different dosage form, why. So there will be few reasons. In that few reasons I will discuss few reasons over here. The first is, if you are considering with the children's or pediatric patients, if you show some of the tablets to the pediatric patients, how they will act or how they will deny to take that tablet. So in orderly for them, we cannot show them with the tablets or capsules. They will either see by they will fear by seeing that, or they will deny to take that. Now particular drug should go inside the stomach, means what we have to do. So either we have to choose or we have to choose another dosage form. So what is a better dosage form for pediatrics? If you are comparing with the solid dosage form, which is tablet or capsules, we can go for a syrup. Now syrup is having syrup is how, means if you are comparing with the tablet, the syrup is like more preferable to the kids. They will be have it happily because either maybe the color of that syrup, it can be very aesthetic in nature, so they may like that color of that liquid, so they don't know it is a syrup, or they know it's syrup but it will be sweet in the taste, they can take it. So this may be the one more reason why we need a different dosage form. For example, if we are having paracetamol 500 mg, if you are taking half of that, it will become 250 mg. So we can give easily for the pediatrics. But what it happens means kids will not prefer this tablets of paracetamol. Instead of that, we can go for either suspension of paracetamol or the syrup of paracetamol, where it is mainly having the action of reducing fever. So this is the one reason maybe we require different dosage forms. Other than this is like if you are considering geriatric patients, means elder patients, what it happens, maybe elder patients are not problems they are having like it is a bitter or something, but they will be having a problem of swallowing. At that time what they have to do? So they can again prefer for a whatever the syrup formulations are there for particular intake of whatever it is required for them. For that again they can choose for a syrups over here. So instead of tablets they can go for a syrups. Other than this, we have to go for, if the patient is unconscious, can I tell unconscious patients to have syrup or tablets? No, it's not possible. So we have to go for as per the requirement. For unconscious patients, I cannot go for a tablet, I cannot go for a syrups, I have to choose the same drug, if whatever the drug requirement for that patient, and for that drug requirement how the different formulations are available or dosage forms are available, for that I have to go. Maybe I have to supply the drug with the infusion, whatever it is, so I have to give injections or something, so the patient can get the therapeutic active effective from the whatever the drug they have chosen or whatever it is required for their body. So these are the few reasons why we need various dosage form. Other than this, why we require the dosage form? Now I told the syrup is good, but syrup, if you are talking, it is having some of the disadvantages or drawbacks I can tell. What is the main drawback of liquid dosage form? The main drawback is like stability. So stability is another problem which are associated with this. So whenever we are going for a liquid dosage form, stability is a major challenge for a formulation scientist. So because the shelf life of the product is mainly dependent on how stable the product is in shelf. So this is what we have to maintain for a liquid dosage form. In the case of sometimes maybe the pediatrics are there, they are having some of the problems to swallow or to take the tablets. In case particular drug is having stability issue, then they have to choose for another dosage from same drug. So this is what they can do. So for liquid dosage form, I am telling the stability is a one most challenges part what we have to face. So this is the mainly drawback of a liquid dosage form. Other than this, we have to go for a injections or something. Maybe injections, when we are talking, maybe the person is unconscious, or sometimes we require immediate action. At that time we cannot wait for tablets, we cannot wait for any of the liquid dosage form, we cannot wait for any other formulation. At that time we have to go for injections. So injections, like if you are giving now, the action will be immediate, because it is a intravenous injection, means it will directly leads to the drug into a blood circulation. So systemic circulation, when drug reaches, the availability or the effect will be there in a immediate manner. At that time we can go for injection format. The next is we are having various dosage forms. It may be can take through the oral route, or it may be can be given through the intramuscular route, intravenous route, or sometimes inhalers will be there. So these all are the different dosage forms. Maybe as per the requirement we have to design the dosage form. So these are the few reasons why do we need various dosage form in same drug, or sometimes why we need various dosage form. We'll discuss different dosage form as of now. The first is solid dosage form. So, the main classification, under that main classification, the first classification is solid dosage form. Now, solid dosage form are the solid in nature, as a name tells, it is solid in nature, which contains one or more drug for therapeutic effect, means one or more API, that is active pharmaceutical ingredient, which is mainly responsible for the therapeutic effect. Other than that drug, what and all the other additives or other ingredients are there, that may be the, it is called as excipients, that may be either binder, coloring agents, sweeteners, etc. Now, examples for the solid dosage form is like tablets, capsules, powders and the granules. So, these are the some of the example for solid dosage form. The next is, what are the advantages and disadvantages of this? The advantages of this is high level of consumer acceptability, compliance and convenience. So, patient is having convenience with the tablet, so he can go for a solid dosage form. Other than that, good physical and chemical stability and accurate dosage. What are the disadvantages of solid dosage form? May be hard to swallow for the children or elders. So, this is already I discussed. It is not easy to take with the children or elders. At that time we have to go for other dosage forms. Impossible for unconscious patients to consume. So, this is another reason why we cannot go for a solid dosage form. No immediate release. Already I discussed these 3 points. No immediate release. Effect will not be immediate. So, we cannot go for a solid dosage form. The next is liquid dosage form. Liquid dosage form are pourable medicines. They contain a mixture of more than one drug, either in a dissolved or suspended form. So, now what is a dissolved and suspended form? We will discuss in coming slides. In an appropriate solvent. So, solvent will be there as a main ingredient here. So, examples include for this is syrups. Also, it is a solution can be the example for liquid dosage form. Other than this, it is a suspension can be the example for liquid dosage form. So, what are the classification? Maybe that is a main classification, that is liquid dosage form. Now, what are the sub-classification of liquid dosage form? That is monophasic liquid dosage form. So, what is monophasic liquid dosage form? So, monophasic means, as a name indicates, there will be one phase in that. So, liquids for external administration. So, what is the liquid for external administration? Liquids used in mouth. So, you know that gargles we will use, mouthwashes we will use, that all are example for liquid dosage form. Under that it is a monophasic liquid dosage form. Under that it is a liquids for external administration. So, liquid applied to the skin, that can be the lotions, liniments, collodions. So, these all are the example for liquid applied to the skin. The next is liquid which is instilled into the body cavities. So, if you are talking with the ear drops, nasal drops or the eye drops, that all will come under the liquids instilled into the body cavities. Now, liquids for internal administration. So, in this the syrups will come, mixtures will come, elixirs will come, linctures will come. So, we will see this is what the monophasic liquid dosage form. Now, we will see what is the biphasic liquid dosage form. So, biphasic liquid dosage form is mainly it is solids in liquids and liquids in liquids. Now, what is solids in liquids? What is liquids in liquids? So, solids in liquids, if you are going solids in liquids for oral route, then suspension can be the example. What is suspension now? Suspension, as a name indicates, there will be suspending. So, what it happens, there will be a two phase, hence it is called biphasic, that is dispersed phase and dispersion medium. In dispersed phase, what it happens means small particles will be there. So, whenever, particularly if I am talking about paracetamol suspension, in a label of that syrup, it will be written as like shake well before use. Why that label comes shake well before use? I told some of the particles will be there. Maybe you have taken yesterday night for a kid, that suspension, and the next dose is next day morning. So you wanted to take next day morning. What it happens from the storage term, from the night to morning, it will be like all the particles will be settled down. Now what you have to do it to redisperse it means you have to shake well before use. So that will be the main, or it will be the added label in a suspension bottles. The next is parenteral. It will be their solids and liquids, as well as the external. As the lotions we will going to take, it is a solids in liquids. Sometimes some lotions contain some of the particles in it. Now we can go for liquids in liquids. What is liquids in liquids? If you are going for oral, it is a emulsion form. So liquids in liquids means oral, under liquids in liquids, oral administration, example is emulsion, external is liniment. So these are the main sub classification of main classification. What is that? Liquid dosage form. It is sub classified into monophasic liquid dosage form and biphasic liquid dosage form. We will see what are the advantages of this liquid dosage form. Liquid dosage forms are quite helpful for the patients who suffer from swallowing the medicines. The rate of absorption of a liquid dosage is relatively better than the solid dosage. It is quite flexible and it can be consumed in several doses. So what it happens, maybe the person has to take, or the patient has to take 5 ml of syrup. Maybe first he or she can take 2.5 ml, again 2.5 ml, it can be done. But in case of tablets, maybe if it is tablets of like coated tablets, maybe I cannot go for a, I will cut the tablet into 2 parts and I can take it like next half an hour. No, it is not possible. If it is a coated tablet, whatever the size of that tablet, you have to take it once. So it is not possible in a solid dosage form. So this is what the added advantages for a liquid dosage form. The next is the disadvantages. Liquid dosage require a lot of storage capacity. I told it is having so much problems of stability. So we have to go for whatever the storage condition of the particular liquid dosage form. The next is it can be easily affected by the microorganism. Why easily affected by the microorganism? One, due to the, maybe if you are used water as a solvent, water is a medium for the microbial growth. This may be the one reason. Other than that, liquid dosage form contains sometimes a sweetness. Maybe for that sweetness, the microbial attack will be there. So all these are the reasons or disadvantages of liquid dosage form. The next is semi-solid dosage form. What is semi-solid dosage form? Semi-solid dosage form contains one or more APIs, that is active pharmaceutical ingredient, which is either dissolved or uniformly dispersed in a suitable base. It contains suitable excipients such as emulsifiers, viscosity enhancers and antimicrobial agents. What are the examples for semi-solid dosage forms? Ointment is one example. The next is like mainly oral paste will be there for oral ulcers, that can be the example, as well as the gels can be the example. So these are the some example for semi-solid dosage forms. So what are the advantages? Convenient for unconscious patients. So maybe the patient is in bed and unconscious, he or she is having some of the allergic effect. At that time the particular person can go for some of the ointment or creams which is having that antifungal or antibiotic effect, that can be given for unconscious patients. Other than that, suitable dosage form, suitable dosage form for bitter drugs. If the drug is bitter, cannot give in a oral form, we can go for a semi-solid, that is either form of cream or form of ointment, whatever it is. More stable than liquid dosage form. I told there, like liquid dosage form is having one issue of stability. Now if you are comparing with the liquid dosage form, semi-solid dosage form is more stabler whenever we are comparing with the liquid dosage form. Next is what is the disadvantages? There is no dosage accuracy over here. This is what the main disadvantages of the semi-solid dosage forms. less stable than when compared with the solid dosage form. It is more stable when we are comparing the liquid dosage form, but it is a less stable whenever we are comparing with the solid dosage form. It may lead to the irritations or any of the reactions in a patient, that chances will be there. These all are the disadvantages of semi-solid dosage form. The next is what is novel drug delivery system. We have seen what is a solid dosage form, we have seen what is liquid dosage form, what is a dosage form of novel drug delivery system. Now, if you are going for a novel drug delivery system, so what are the novel drug delivery system? Novel drug delivery system refers to the approaches mainly, and it will be having some of the formulations and technologies which are involved in that, and system for transporting a pharmaceutical compound, that is what API or drug, in the body as needed safely to achieve its desired therapeutic effect. So, examples for a novel drug delivery system is mainly liposomes, nanoparticles, solid lipid nanoparticles. So, these all are the examples which will come under novel drug delivery system. So, what are the need of novel drug delivery system? So, we can go for a controlled release, we can go for improving the drug stability, enhanced drug bioavailability, specific site target. So, this is a main requirement whenever it is required for some of the diseases. So, specific site targeting, as well as reduces local and systemic side effects which are associated with the drug or any other problems which are associated with that can be reduced by selecting or by opting a novel drug delivery system. So, what are the advantages and disadvantages involved in novel drug delivery system? First, we will see what are the advantages. So, achieves targeted drug release, controlled drug release, reduces dosing frequency. What are the disadvantages? That is high cost, cannot afford by all the patients, and it is a less stable. So, these are the some disadvantages which are associated with the novel drug delivery system. Now, we will discuss one dosage forms or one examples for dosage forms. So, I told like solid dosage form is there, liquid dosage form is there, semi-solid is there, and novel drug delivery system is there. And in this all, API is a common. So, active pharmaceutical ingredient is a drug which is responsible for the pharmacological action. Other than that, I told there will be use of some of the excipients. Now, what are the excipients will come under solid dosage form? The excipients other than the API is anti-adherents, binders, coating agents, disintegrants, filters whenever it is required, and lubricants, glidants, etc. So, these are the excipients other than the API. Now, in liquid dosage form, other than the API, solvents will be there, co-solvents, buffers, preservatives, sweetening agent, surfactants, etc. In semi-solid dosage form also, bases will be there, preservatives will be there, some of the solubilizing agents will be there, gelling agents will be there. Now, with the nano formulations or novel drug delivery system, API will be there. Other than the API, what will be there? That will be the polymers, which is mainly acts as a carrier, and lipids, cross-linking agents, gelling agents, mucoadhesive agents, etc. So, these are the excipients which are used other than that of the API, that is active pharmaceutical ingredient. Now, as a name indicates, it is a tablet, we know it is a solid dosage form, or it is an example for solid dosage form. A tablet is a solid form of medicine, usually round or oval, that is intended to be swallowed. So, what are the components? The compositions will be the API, excipients. Now, you know what is API, that is active pharmaceutical ingredient responsible for the pharmacological action. Excipients, inactive ingredients like binders, fillers, or flavoring agents which can be used in a tablet form. The next is like what are the types of tablets, that is conventional tablets, regular tablets that dissolve in the stomach, chewable tablets designed to be chewed before the swallowing, effervescent tablet dissolves in a water, sublingual tablet placed under the tongue for quick absorption, extended release tablet, mainly it is having over time release in or release of drug in a slowly at a over time. So, extended period of time the drug release will be there. So, in extended release tablet we can reduce the dosage frequency. Maybe initially the patient used to take 2 tablet of same drug per day, means if the tablet is extended release tablet, then only 1 tablet at 1 day. So, this is what the main advantages of extended release tablets. The next is capsules. We know this is also example for solid dosage form, and it contains medicine inside the shell, typically made from the gelatin or plant based material which dissolves in the stomach. So, composition: shell, the outer coating that holds the medicine, usually made of mainly made of from the gelatin or any other vegetable based materials. Other than this, it contains the inner material which can be powder, liquid, pellets containing active ingredients. So, you have seen some of the capsules. Inside that, whenever if you open by mistakenly the capsule shells are open, means sometimes spilling out of powders will be there. So, that maybe it contains inside it inside of it is a powder form. Sometimes it will be liquid form, sometimes it will be a granules form or pellets form. What are the types of capsules? That is hard gelatin capsules, typically used for powders or granules with the 2 pieces that fit together. So, by mistakenly if you opened it, it will be powders inside or granules inside. Soft capsules usually mainly for the liquid or oil based medicine. If active ingredient is in liquid form, means we can go for or in the it is like it is not so much of liquid in the form of gel, at that time we can go for soft gelatin capsules. So, this is another type of capsules. The next is lozenges and pastilles. So, what is a lozenges? So, mainly lozenges are small solid medicated tablets designed to dissolve slowly in the mouth to deliver medicine locally, often to treat the sore throats or any cough related issues. So, common ingredient in this is lozenges includes menthol, honey, lemon or medical substances like benzocaine for the pain relief, dextromethorphan for cough purpose. So, this is mainly we can give examples of capsules. So, capsules is example for lozenges. So, capsules or strepsils can be come under the classification of lozenges. The next is like what is pastilles. So, pastilles are similar to lozenges, but are typically softer than the lozenges and often contain a higher concentration of flavoring or medicinal ingredient. They are also meant to dissolve in the mouth, but it is softer than that of the lozenges. Common ingredient in pastilles include gelatin, sugar or gum to give the softer texture than the lozenges. Next we will see what is oral solution. An oral solution is a liquid dosage form which where the API, that is active pharmaceutical ingredient, are completely dissolved in a solvent, typically water for easy ingestion. Means we can tell it is a monophasic liquid dosage form, because here where the APIs are completely dissolved they are telling. So, completely dissolved means oral solution or oral syrups, that is example for monophasic liquid dosage form. We will see what is oral emulsion. Now, oral emulsion, as the name indicates, it is containing 2 immiscible liquids. So, 2 immiscible liquids means how we can miscible with each other, maybe oil and water they are telling. In usual case, if you are taking oil and water, it is not miscible with each other. So, how we can make it miscible with each other? By adding emulsifying agent. So, this is what the speciality of emulsion. So, it will be going to mix together with the help of an emulsifying agent. This creates a stable system where the tiny droplet of oil will be there and the droplet of liquid are dispersed in another whatever the phase will be there. So, there will be, it is a biphasic, and they are telling it contains 2 immiscible liquids. For example, it contains 1 oil, 1 water. Now, in usual case oil and water will not going to mix, but to mix that we are going to add emulsifying agent. So, this is the main role of emulsifying agent, mixing oil and water together and coming up with the emulsion. The next is oral suspension. I told that there are two phases, that is biphasic dosage form. For biphasic dosage form, we are given example of suspension and emulsion. We have seen what is emulsion, we will see what is suspension now. An oral suspension is a liquid dosage form in which solid particles of the active ingredient are dispersed in a liquid medium. So, the solid particles do not dissolve but remain suspended in the liquid. In previous slide, I have given example paracetamol suspension. I told in a label it will be mentioned that shake well before use. Why shake well before use? The solid particles do not dissolve in a suspension, but it will going to remain suspended in the liquid. Only for this reason, to redisperse it, we have to go for shake well before use. So, this is the example for different oral suspension, emulsion or oral solution. The next we will see linctus. So, it is also liquid dosage form. Linctus are a type of medicinal syrup or liquid formulation that typically used to soothe the cough and the throat irritations. Any throat irritations are there, at that time we can go for a linctus. They are usually thick liquids and their purpose is to provide relief from the coughing and ease the throat. So, whatever the throat irritations will be there, for that we can go for a linctus. They may contain active ingredients like soothing agents, expectorants or any other agents which is required mainly to have a relief from the throat irritations. The next is semi-solid dosage form. We can take one example for semi-solid dosage form, that is ointments. So, ointments are a type of semi-solid dosage form used for the external application to the skin or mucous membranes. They are designed to deliver medications locally or in some cases to facilitate the systemic absorption through skin. So, we can go for ointments. So, Dermix is a one ointment which is mainly example for the semi-solid dosage form. We will see what are the compositions of this, that is active ingredient will be there, base will be there, additives will be there. Active ingredient is mainly responsible for the therapeutic effect. So, you can take corticosteroids, antibiotics, antifungals. So, these can be the drug can be given through the form of semi-solid dosage form, that is in the form of ointment. Base, the substance that holds active ingredient which can be oil based, that can be the petroleum jelly, lanolin, or water based, that may be the hydrophilic ointment. Additives, to enhance the stability or texture or preservation, they can go for emulsifiers and preservation techniques. The next is suppository. This is also example for a semi-solid dosage form. It is designed inserted into the body cavities such as rectum, vagina, urethra. So, where it dissolves or melts, releasing its active ingredient. When it melts, when the body temperature rises, at that time it will, or it reaches to the body temperature, it will going to melt. When it melts, it will going to release the active ingredient. It is mainly for local or systemic effect. So, Biscodil or Dulcolax, it is a brand name for one suppository which is available in the market. The next is composition, the therapeutic drug that provides the desired effect. The pain relievers can be done or laxatives can be there. Base are substance that holds the active ingredient which allows melt at body temperature, facilitating the absorption of the particular drug. When it is going to melt, it will going to relieve the drug. So, now base, what can be the base in suppositories? That can be the cocoa butter, glycerin and polyethylene glycol. So, these are the example for bases in suppository formulations. So, I told it can be used for rectal suppository, vaginal suppository and the urethral suppository. What is rectal suppository? Commonly used for the local treatment, example hemorrhoids, rectal infection or systemic absorption. Vaginal suppository often used for treating infection, antifungal treatment or hormonal therapies. Urethral suppositories mainly it is a less common, but it is used for some of the local treatments. What is parenterals? So, parenterals we know it is an injection, it gives immediate effect whenever it is required for the patient. So, an injection or infusion method of administering medication into the body using hollow needle and a syringe which is pierced through the skin, but it will be a little painful. So, injections, so many injections are there as examples. So, intravenous injection administered mainly directly into the bloodstream. So, the action will be immediate over intravenous injection. Intramuscular injection, drug administered into the muscles. Subcutaneous injection, it is administered as a bolus into the subcutaneous, the layer of or the skin directly below the dermis and epidermis. So, this is what the subcutaneous injection. The next is inhalers. So, inhalers are devices used to deliver the medication directly to the lungs. Now, if the drug is wanted to deliver to the lungs, if you are giving through a tablet or any other formulations, it will be not so effective. For that we can go for an inhaler formulation. It is mainly to treat respiratory conditions like asthma, COPD, that is chronic obstructive pulmonary disease, and or other breathing related issues can be also treated by the inhalers. What are the types of inhalers? That is meter dose inhalers, we can call it as MDIs. They use a propellant to deliver a precise amount of medication in the form of spray. Dry powder inhalers, DPIs, deliver the medication in a dry powder form. They require use inhale forcefully to get the medication into the lungs. The next is soft mist inhalers. This creates fine mist of medication that is inhaled. So, inhalers are easy to use than the MDIs, that is meter dose inhalers, which can deliver the medication in a gentler, slower mist form. The next is nebulizers. These are the larger machine it contains, which turns liquid medication into a fine mist, and it delivers particular drug into the region wherever it is required. The next is nanoparticles. I told novel drug delivery system. Under that we will see only one, this one, that is nanoparticles. So, what is nanoparticles? Nanoparticles are tiny particles with a diameter of 1 to 100 nanometer that are invisible to the naked eye. They made up of aggregated atoms or the consolidated into well defined shape and size. So, nanoparticles is having its own shape and size. So, it is a scanning electron microscopy picture of the nanoparticles. So, SEM pictures will looks like this. If any formulations are there, it will observed under the SEM microscope, means it will looks like this. Maybe in the, it is in a dried form, so we can look it like this. The next is types of nanoparticles. What are the types of nanoparticles? So, metallic nanoparticles. So, metallic nanoparticles includes nanoparticles which is made up of metals like gold, silver and copper. So, metallic nanoparticles have applications in electronics, sensors and medicine due to their conductive and catalytic properties. So, due to these properties, this is applicable in a medical purpose also. So, usually the metals used as gold nanoparticle, silver nanoparticle, copper nanoparticle. So, it is named it like that. The next is polymer nanoparticles or polymeric nanoparticles. It is widely used nowadays in medical field or pharmacy field, made from the biodegradable polymers. These nanoparticles are often used in drug delivery systems because they can encapsulate the drug and release them in a controlled manner. So, this is a wide accepted topic or widely discussing topic in the field of drug delivery system as of now. The next is carbon based nanoparticles. This category includes carbon nanotubes, graphenes, which are known for their extraordinary strength, conductivity and other unique properties. The next is liposomes. These are nanoparticles made up from the lipid molecules which are mainly encapsulate the drug, making them useful in the drug delivery, particularly for targeted treatment in cancer therapy. So quantum dots are the semiconductor nanoparticles that can emit light of a specific wavelength when it is excited. They are used in the application of any of the displaying technology or imaging technology and solar cells. So quantum dots are used. So what are the advantages of nanoparticles? I discussed already for advantages of novel drug delivery system. So these are the common effect for nanoparticles also, like those are the advantages which comes under novel drug delivery system. So targeted drug release will be there, improves bioavailability, sustained drug delivery, as well as it is having diagnostic and imaging purpose, as well as it going to reduce the frequency of dosage. So these are the advantages of nanoparticles. The next is challenges which are associated, mainly the toxicity and safety, also the cost. So these are some challenges which are associated with the nanoparticle formulation. Other than that, environmental effect, stability issues will be there, as well as regulatory challenges. So it is easy to prepare in laboratory scale, but whenever it goes for industrial scale, it is one challenge mainly to get the product from laboratory scale to industrial scale. So these are the few challenges which are associated with nanoparticle formulation or any of the novel drug delivery systems. So coming to the summary, or I will conclude that like dosage forms are essential for safe, effective drug delivery. The choice depends on the patient needs, drug properties and therapeutic objectives. Dosage form ensure proper drug absorption, maximizing the therapeutic effect as well as minimizing the side effects. So these are the main motto of the dosage form. We have to enhance the therapeutic effect and we have to minimize the side effects. These are my references. Thank you.